Today I'm submitting a letter from organizations that are advocating for a complete ban on fracking and all its activities within the Delaware River watershed. That is a ban on fracking and frack wastewater discharges, as well as the withdrawal of water from the Delaware River watershed to enable fracking to occur outside of the basin. You're going to hear today from activists and residents and representatives of organizations who are advocating for a full ban, and who are here to say that Governor Murphy, who has recently filed a letter with the other governors and the Delaware River Basin Commission requesting that a full ban be moved forward by the Commission. We're asking that the other governors here join with him in that request. We're going to hear about the harmful health impacts that health professionals from an organization in New York have studied over the last several years. They released a new edition of their compendium in the early 2018, and that documents where fracking is occurring, health effects are happening that are harming public health and individuals. Also, scientific studies show us that through the process of oil and gas operations, including shale gas extraction, people's health are impacted by those operations. And you're going to hear from a representative of that organization today. But I'd like to read just a portion of the letter that we're submitting to you today from organizations. It says in January 28th letter to the Commission, New Jersey Governor Phil Murphy detailed his support for a complete watershed-wide permanent ban on fracking and its associated activities. In doing so, Governor Murphy cited the dangers of fracking chemicals, the hazardous materials that fracking produces, fracking wastewater's secret toxic chemicals, and the dangers of damage to the water supplies of the Delaware River watershed. Commissioners, you decide the regulations and policies that govern the water resources of the basin. And most importantly, you are the stewards of the river, its watershed, and its irreplaceable water supplies, the health of its residents, living communities, and habitats. We ask you to join with Governor Murphy in his request articulated in his January letter, that you work with him, quote, to ensure the Commission's final rules provide a complete ban on all fracking activities. Please, Commissioners, save the Delaware River and its watershed from fracking. Ban fracking and all its activities. Ban it all, and do it now. Thank you.
Thank you. Thank you, Commissioners. I'm here to read the letter from the concerned health professionals of New York. It's signed by co-founders Sandra Steingraber and Dr. Kathy Miller. Dear Chairman Phil Murphy and Commissioners Andrew Cuomo, Tom Wolf, and John Carney, the concerned health professionals of New York and Physicians for Social Responsibility released the 5th editions of the Compendium of Scientific, Medical, and Media Findings demonstrating risks and harms of fracking in March 2018. This authoritative report, started in 2014, examines the impacts of fracking on the environment and public health. The findings are highly relevant to the DRBC's consideration of a permanent ban on fracking and its associated activities throughout the Delaware River Basin, including a ban on wastewater storage, processing and discharges in the basin, and a ban on water exports from the watershed for use in fracking elsewhere. The compendium was submitted to the Delaware River Basin Commission during the public comment period regarding the Commission's draft natural gas regulations in 2018. Numerous comments by the public based on the findings of the report contained in the compendium regarding health effects of fracking and its related activities were submitted to the DRBC's record as well. The compendium analyzed over 1,200 peer-reviewed research articles on the impacts of fracking. Many of the reports included in the compendium document harms to the health of people who live in Pennsylvania's Marcellus Shale region, the same formation underlying much of the Delaware River Basin and the likely source of wastewater that would be imported for disposal. If the DRBC does not prohibit the activity, as health professionals, we are asking that you consider your upcoming decision regarding a complete ban on fracking and its activities in the context of these scientific studies of impacts and the plethora of adverse human health impacts that have emerged with the advent of fracking. The conclusion of the report is clear. The findings to date from scientific, medical, journalistic investigations combine to demonstrate that fracking poses significant threats to air, water, health, public safety, climate stability, seismic stability, community cohesion, and the long-term economic viability. Emerging data from a rapidly expanding body of evidence continue to reveal a plethora of recurring problems and harms that cannot be sufficiently averted through regulatory frameworks. There is no evidence that fracking can operate without threatening health or without imperiling climate stability upon which public health depends. We request that you, as the commissioners, who have the responsibility to decide on the proposed ban and the draft gas regulations, vote yes for a watershed-wide ban on fracking and no on proposed draft regulations that would allow fracking wastewater and water withdrawals for fracking. Instead, vote on a ban on all of these activities. Thank you.